Welcome to Genius Insight. It's very inspiring that you have been showing support to us by staying with us. Today, I'm going to introduce a very important issue to you, which is yeast infection, and how you can recognize the symptoms and causes, treat this itchy and uncomfortable condition, and tips to prevent one from happening to you. Yeast infections are a form of fungal infection occurring in both women and men. If you've ever had a yeast infection, we feel your pain, because yeast infections are rough, and that's us being nice about it. Not only does it involve an itchy vaginal area, especially for women, or the external genitalia area of men, which can make for some seriously awkward moments, but unlike cramps and PMS, a yeast infection also won't just go away on its own. Instead, you have to be proactive in treating yeast infections. In this case, the sooner the better, in part because it means the symptoms will stop that much sooner. And that counts for a lot. For if there's anything that can drive every single person up the wall, it's an itchy vaginal area. If you are experiencing yeast infection symptoms, schedule an appointment with a specialist doctor to make sure it is not a symptom of a larger health issue. So, what is a yeast infection? What causes a yeast infection? Are yeast infections contagious? What are its symptoms? What are its risk factors? How do you know if you have an infection? How are you going to treat it? Finally, how to prevent a vaginal yeast infection. Well, in this video of Genius Insight, I will try my best to answer these bunch of questions, and I believe this information will help you understand what your choices are so that you can talk to your doctor about them. So, let's dive into the video. By the way, if you enjoy content like this, don't forget to hit the like button, subscribe to the channel if you're new, and turn on notifications so you never miss a new video. What is a yeast infection? Yeast infections are a form of fungal infection occurring in both women and men. One of the most common forms is called vaginal candidiasis, a yeast infection of the vagina. Infections of this type are marked by itchiness, irritation, and a whitish or watery discharge from the vulva. Most vaginal yeast infections are relatively mild and easy to treat. More complicated infections typically occur in conjunction with pregnancy or another medical condition. Though not viewed as sexually transmitted, yeast infections have been linked to increased sexual activity, vaginal and oral. Symptoms. The following symptoms are associated with a vaginal yeast infection: swelling and redness, itchiness, irritation, genital rash, a whitish vaginal discharge with a lumpy or watery consistency, a burning or painful feeling during urination or sexual intercourse. What is the cause of a yeast infection? The cause of a vaginal yeast infection is yeast, especially the single-celled fungus known as Candida albicans. It often lives with other microorganisms inside the human oral and gastrointestinal tracts. Most yeast cells are benign but can turn pathogenic if not held in check by healthy bacterial strains that are also native to the digestive system. Anything that disturbs the natural balance between fungal and bacterial populations in the gut can spur yeast growth and infection. Risk factors. Many things can trigger the yeast overgrowth that causes a yeast infection, such as pregnancy, a weakened immune system from conditions such as HIV and medical treatments, including chemotherapy, uncontrolled diabetes, natural hormonal swings, wearing non-breathable underwear, douching, using scented feminine products, wearing wet clothing for a prolonged period of time, having sex with someone who has a yeast infection, having oral sex, or having sex for the first time. Treatments for vaginal yeast infections. If you had a yeast infection before and are certain your symptoms are caused by a yeast infection, you can try over-the-counter medicine such as an antifungal cream. If over-the-counter or home remedies don't relieve your symptoms within a few days, contact your doctor. We can often prescribe a one-dose pill, diflucan or fluconazole, or suggest other longer-term treatment options. Prevention. Here are a few preventive measures that can be taken to avoid infection. Wearing cotton underwear. Avoiding tight-fitting pants and undergarments. Changing out of wet clothing as soon as possible. Avoiding douching. Managing your diabetes. Not having sex with someone who has a yeast infection. Yeast infections are common occurrences, but prompt treatment can help reduce the uncomfortable symptoms within a few days. By recognizing your own risk factors, you can prevent future infections. Talk to your doctor if you have recurring yeast infections that last longer than 2 months. That's it for now, and hope these will be helpful to make the right decision if you are suffering from a yeast infection. Please comment below if you have any views about the video content. Make sure to subscribe and hit the bell icon for the new video notification.